Hey everybody, we are back, Sean and Kevin. Today's a special episode since we know the holidays are among us.
Last one before next year.
Yeah. So we're going to take a little break after this one, but today we figured we'd talk about something that's pretty important over the holidays, drinking. So we got two types of drinking. We have scotch and we have water. Oh, here we go. Val, we're live. We're live, Val.
I know.
Okay, thank you. All right.
Thank you very much, Val.
Thanks, Val.
Okay. So
we're actually talking hydration.
Yeah, we're talking hydration. So we know a lot of us are going to probably have a few drinks over the holidays. So I always like to tell patients, we're not crazy. We also like to indulge a little bit. But it's all about balance, people. We need to have a little bit of water with the alcohol. So not necessarily in the same glass, but maybe just accompanying it.
So it's a rule of thumb. It's good to follow up. If you are indulging in the holiday spirits, follow up with a glass of water.
That's it.
It's actually a veteran tip to avoid the holiday hangover as well.
That's right. Dion Cochran's listening.
Yeah.
You should use that tactic.
So what do you want to start with?
Well, let's start off. What we're going to do today, just to give you an overview, it's going to be pretty quick. Water is a really essential thing to us staying alive. So basically, we want to just tell you a little bit about, one, the quantity, the kind of myths around how much water we should have on a daily basis, and then two, the quality, obviously, of that water. So we got to keep in mind that, we have a lot of...
Hey, Stephanie.
Hey, Steph. We have a lot of people that maybe don't know about what's in our water, in the water system, if you just drink it out of the tap. So this could be, it's just to inform you guys on how can you filter that properly and what are the essential kind of companies that are good at doing that and product that you can use to do that, that wouldn't be very costly.
Yeah, so let's kick it off with quantity.
Sure.
So last week I touched upon this analogy of grapes and raisins, where a raisin is just a dehydrated grape. So when we look in terms of our cells, our health, our body is anywhere from 70 to 90% water, just depending on what system or cell we're talking about. Water is essential to life, like Kevin said. It's one of the most important things. We need it. We need it for everything. Our environment, everything. Everything feeds and breeds often in water. So when we talk about quantity, it's tricky, right? We want to make sure our cells are like grapes instead of raisins. And most of us are walking around with cells like raisins. That affects your tissues. That affects your joints. That affects the cell itself, the cell health.
Well, on that note, not to cut you off, but so a lot of people come in actually and they're suffering from certain problems and pain and discomfort actually just because they're dehydrated.
Right? It's crazy. There's two really awesome books written by an MD. I'm drawing a blank on his name, but the first book he wrote was The Body's Many Cries for Water. And then his second follow-up book is You're Not Sick, You're Just Thirsty. And it's insane where he traces the disease, the dysfunction and the disease process that's just associated to a lack of hydration.
Yeah.
Anything from constipation to headaches, digestive issues, arthritis, joint inflammation. Everything can be associated to that lack of water or that not enough hydration. So in that book, it's worth it. It's an excellent read.
Yep.
I actually just reordered them this morning because over the course of the last few years, I've given them out to someone and I have never gotten them back. So if you have my books, bring them back.
Yeah.
And if not,
book thief. I have a few of those.
I ordered two more today. I ordered both those books because they're, hopefully Kelly doesn't get mad about my ever growing collection of books. But they're so important. So let's get into, like we say, what are some of the common symptoms from lack of water or not enough? The quantity aspect. We have dehydration. We have constipation. This is an interesting question. So Jen,
thank you, Jen.
Does beer count as water?
It's actually something we forgot to mention.
Yeah.
So
we'll get into that.
I'll tell a little story actually. So I can remember because one of the symptoms actually of dehydration is dementia. So I can remember my grandmother telling me, well, that's ridiculous. I drink 5 coffees a day. And so it's important also to realize that not all liquid equates water.
Certain fluids will cause your body to leach water,
Yeah.
right? So so they're the
Any diuretic, so like a caffeine, anything with caffeine in it.
alcohol
Beer, gin does not
count as
Count as
water.
water.
There is lots of water in
Nice
beer,
try.
but it does not count as water.
Scotch does not count as water.
So as a rule of thumb, like we say, if you're having an alcoholic beverage, a caffeinated beverage,
Yeah.
you have to follow it up with a glass of water just to get back to zero, just to get back to neutral.
Balance it
right?
up.
And it might even be worse than that, but just to get back to zero as a rule of thumb, follow up a caffeinated beverage,
Yeah.
an alcoholic beverage with a glass of water.
No.
So, all right, let's get back to quantity. Okay,
Mm.
so we had that analogy of grapes and raisins, right? We want ourselves to be like grapes, not like raisins.
So how much should we drink per
So
day?
here's the thing: there's two kind of formulas that we can look at. One's a really simple one, which will give us the high end of where we would like to be with in terms of optimizing your hydration levels. So that's per 50 pounds of body weight, you want to try and drink a liter of water. So if you're 150 pounds, you want to aim for 3 liters of water. Now people are going to be like, that's insane. I could never drink 3 liters of water. And my answer is maybe initially not, but yes, you can. Your body will thank you for it if you can get to that level. So on the low end, right, so to know what zone you should at least aim for, there's a little bit of a more complicated formula, and it's your body weight times 0.55 will give you the number of ounces of water that you should aim for. So if you want to convert that to liters, because I told you about 1 liter to 150 pounds, or per 50 pounds, you just divide that number by 38 to give you your number in liters. So if you're 150 pounds, roughly that means 2.2 liters. So there's your zone between 2.2 and 3 liters of water per day if you're 150 pounds. Now,
so let me ask you this then. So,
Yeah.
okay, you got someone that does absolutely no activity, just goes to work, and they come home and they go to bed and that's it, versus someone that's
active,
super active,
exercising.
doing maybe an active
So
job.
this is huge. Environment takes into account, activity level will take into account your hydration levels. So we need to look at things like, what are you drinking, right? So Kev's got to follow up that nice glass of scotch
Very good, by the way.
with and this is not something we do every day. This is a holiday.
This is a holiday episode.
This is a holiday episode, so
We're not encouraging it.
we're not encouraging it. This is something that you have to drink responsibly. But you would like to follow that up with a glass of water. So the different things that you drink will affect your hydration levels. That's so important. Your environment. So if you live in a hot, humid area where you're sweating a lot, well, guess what? You're going to have to drink more water. Dry, right? If you're flying will affect your pressure, right? Altitude will affect your hydration levels. So you need to drink more water. A dry environment will affect your hydration levels. You need to drink more water. Exercise. So if you're intensely exercising every day, then you need to drink more water. So these are things to take into account. Now, how do you know if you need more water? Well, this is one thing we preach. You have to listen to your body, right? You got to listen to the signs and symptoms your body is always throwing at you. So think about this: dry lips, dry mouth, water. Painful joints, right? Water. Trouble with digestion, water. Listen to your body. Your body's giving you these check engine lights. Tap into those.
Yeah.
It's awesome when you start actually tuning into your body. Man,
Obviously, that's the message we're always trying to teach people, right? Listen to what's going on. For sure, yeah. There's so many symptoms associated to dehydration. So
the list is actually endless, and that's why those two books we mentioned. You're not sick, you're just thirsty, or your body's many cries for water.
Yeah.
All right, Kev, let's talk about quality. This is
Okay.
This is the next level, right? Because this is so important. This is just as important as quality, but some would say a little controversial. But it's actually not.
There's tons of research on this, so
it's pretty interesting.
Yeah. So in terms of quality, okay, so we got to be honest. Like the water coming out of our tap, basically, you know, this is not exactly the best quality of water we could have. They're obviously like the amount of chlorine that they use to clean the water is kind of necessary to take bacteria out of water that shouldn't be there, that could make us sick. So we understand why that's happening. Now the thing is after that, there are so many tools we can use to help filter the water to a point where it's more beneficial for our system because you'll have less toxicity in it. So now, people often we'll talk about.
Let's talk about the three.
Well, we'll talk about a few little things that are in
Chlorine.
it. Chlorine would be a big one because we find a lot of people that actually have intolerances to chlorine.
Chlorine too. There's a really cool.
We'll just say hi to Andrew and
Drew.
Sarah. Yeah. Nice to see you guys. So we have chlorine, we have fluoride. Yeah. Fluoride's a big one. A little bit. When Sean was saying controversial, that might be the one he's talking about. We're told fluoride's in the water system. I don't want to get into the whole thing about it, but is in the water system for our teeth.
I'm not too
sure about that.
It shouldn't be. Anyways, it's there.
And in most cities in Canada, there is no fluoride except for the cities of the West Island.
Unfortunately.
So not all of them, but you'll have Beaconsfield, Point Claire,
Dorval.
Dorval no longer. I think the machine broke and they didn't buy a new one to dispense it. Anyways, Bay d'Urfé. So all these things are essential to know. So like the big Berkey system we have here at the clinic actually has fluoride filters plus the carbon filters to get all the rest of the stuff
So
out.
why fluoride is bad? We talked about this last week. Fluoride actually calcifies your pineal gland.
Yeah.
Over time, right? So it's not something that happens if you drink one glass of it. No. It's not something that brushing your teeth once in a while with toothpaste in your fluoride that's going to happen. But over time...
It bioaccumulates. So, yeah. So eventually there could be an issue with calcification around the pineal, which again, if people didn't hear the last episode, it was very essential in converting serotonin to melatonin for our sleep. So something to think about. So now what do we do? Filtering systems. There are simple ones that can be jug systems. Brita would be
your
basic filter system. It's not my favorite. But at least takes.
If you want to start there, start there.
At least it takes chlorine out. But there are other jug systems that are actually the filter is actually a lot better. Clearly Filtered is a company that I often recommend, which is very, very good.
We'll put links to these things in the description below, so you guys can check them out. We're not endorsed by any of these.
No.
This is all for you guys to do your own research. Any of these videos, actually, these are just our thoughts and opinions.
Our opinion.
So make sure you guys, do the research. Take.
No.
So, anyways,
we have Big Berkey, which is the one we use at work. It's not the most attractive thing. It just looks like a big silver cylinder.
Looks like a big coffee machine, actually. People actually confuse it with a coffee machine. But.
So that one's great. They have different sizes, so depending on how many people are at home and that it could be very beneficial.
Different filters, right?
Different filters as well that you can choose from, and they're quite good. Like I think our Berkey system, we change every 6 months the carbon filters and every year for the fluoride filters.
Yeah.
So it's not a very expensive thing. At home, I have a Aqua Ovo, which is actually a Quebec company, and they have a nice filter system as well on that one. We don't have fluoride there, so it's not so much of an issue. And that one's aesthetically is nice. It looks like a
piece of art.
Actually. So, and it's quite useful. You can actually mix drinks in it and use that as a thing as well. But you wouldn't filter it, obviously. But so those are like the basic ones we recommend. There are other systems.
Yeah, we just had
good patient of ours, Mark.
Shout out to Mark Toskis.
Toskis is super smart guy. He did
always
a lot of
researching,
research.
Always trying, always finding out. What did it say? Steph's just writing us.
Steph's correcting me.
Usually the fluoride filters are every 6 months, and the carbon ones last us a year. Thank you very much, Steph.
Thanks, Steph.
Anything else we make a mistake, please, Steph, correct us.
Yeah, don't correct me on air, though. So anyways, so Mark had what was the company card?
It's called AquaTrue. So they have a system that's undermount.
Reverse osmosis.
So which is probably the best, right? Which is probably one of the best.
There's a bit of controversy on that because reverse osmosis would take everything out of the water.
Yeah.
So
minerals and
so if I was to pick for myself personally, it would be just a good filtering system just to keep some of the minerals in the water.
Yeah.
Whereas a reverse osmosis will definitely take everything out. So you can play around with that. Some people have ideas on which one is better. Well, definitely for sure the reverse osmosis would be a lot more expensive. And the other systems could be a lot more affordable. So,
yeah, easier to start with.
Yeah, for sure. So I think that's pretty much it. We just wanted to give everyone. Hold on. What's the best system for autoimmune disease? Oh, Miss Tara, good question. Well, anything for autoimmune.
You want to eliminate definitely the
any toxicity.
Toxicity.
So you want to take out chlorine, obviously.
And
if fluoride is in there, that potentially will affect the brain. So we absolutely want to take any of those chemicals out. Now, one thing we didn't mention, which usually when we do our Foundations of Health talk with corporations and stuff, we get into we actually show a video too of on CBC News. There was
this is insane,
which was totally gross.
So we'll post a link to this as well, because this is worth seeing. So
they basically showed that there were some species that were living in the St. Lawrence River that had both sex due to the exposure to all these different chemicals. Now,
not just the chemicals. This is crazy with the medications.
Right.
So this is the
we don't realize how much
antidepressants and the different any prescription medications that your body does not fully break down gets excreted. Right. Our detox systems will try and get them out of us, right? And guess where they end up? In our water system. So this is shocking, right?
Definitely
this video
gross,
is shocking.
Definitely gross. So hence why
hormones. Exactly. So
there's a crazy amount of toxicity in the water if you really break it down to like how much of this medication is in there and how much of it can we get out. So for sure, a lot of the filtering systems, municipal ones, can take out the major bacterial contents and stuff like that. That's why
the bacteria and the viruses, right? Which is what
we're pushing for more of that. We want to just see like, okay, well, can we take out more by doing our own filtering of that water to make sure we take out some of the cleaning agents that they use. So in a nutshell, it's just to make sure that you're trying to get the cleanest water you can to optimize what it's doing to your body. And I'm telling you, it makes a difference.
It's the craziest difference, right? Let's recap. So quantity, if you're 50 pounds or per 50 pounds of body weight, aim for 1 liter of water. That's the high end. The other formula, a little more complicated. It's pounds, right? So if you're 150 pounds, times 0.55 will give you your amount in ounces. Divide that by 38 will give you your amount in liters, right? 150 pounds, that works out to be about 2.2 pound or 2.2 liters. So that's a good target range. Your environment will influence how much water or how much dehydration you can be your body's exposed to. So if you work out a lot, you need to drink more. If you drink alcoholic beverages or caffeinated beverages, you need to drink more. If you work or live in an environment that's hot or dry, you might need to drink more. So those are simple things to stick to. Listen to your body, right? It's always giving you signs. And then quality, right? Let's focus on removing the toxicities.
Sure.
Removing
I see my neighbor is on there. My favorite neighbor right here.
Daniello.
One of them anyways. Yeah. You definitely shouldn't swim in the river, my friend. You got a few issues, so I don't think you need to add on to that.
Anyways, guys, we wanted to wish everyone a happy, healthy holiday.
Absolutely.
A big thank you to all you this year. 2017 was great. We can't do what we do without you guys. Thanks for being our patients. Thanks for listening to us and putting up with us and making it fun for us to show up every day to work.
Absolutely.
Because, we got a great team here at Vitality. If you haven't checked us out and you're just meeting us for the first time, give us a call. We can help you, and if we can't help you, we
send some topics
we'd love to hear topics. Right? What are you guys interested in?
Dating.
Kev's an expert on dating. Yeah.
No, well, I'm not an expert, but
so. There's no video next week. Steph,
Thank you, Stephanie.
Thank you, Steph. There's no video.
Honest. She's so honest.
She's always got to reel us in.
Yeah.
No video next week. Stay tuned for the week after. I think Kev's still going to be slacking and on vacation. I'll be back for that one. I'm going to have my co-host will be Valerie Parent.
Ooh, Valerie.
Debut. VPH, as I like to refer to her. She's our physiotherapist. A lot better
looking than me.
Yeah, she's way better looking than Kev.
Yeah.
She's awesome. A lot of you know who she is already. You come see her. So stay tuned for that. We will send an email with a topic. I know in the new year we're going to do something on detox because that's a really, really big one. Post-holiday, we're going to talk about the body's detox systems. I don't know if that'll be the first week in January with Valerie. It might be with Kevin and myself. But we're definitely going to do detox.
I think a cool one is we're gonna do. It's been coming up. I think we're hey April. We're gonna do one on mindset.
Yes, an important one. We'll do that in the new year too, because mindset.
It's a big one coming up.
What do people encounter around the start of the new year? All these goals, right?
Yeah,
all these
goals.
New Year's resolutions. So we'll touch on that because that's
some advice on how to keep those goals and strive through that.
So anyways, exciting
have
year.
A great holiday, guys.
Exciting year. Have an awesome holiday with your friends, family, and loved ones. Give everyone a hug for us, and
we'll see you soon.
We'll see you next year. All right.
Ciao.